On July 27, 2020, in the first wave of the COVID-19 pandemic in North America, Discover Long Island announced that Dr. Michele C. Reed, a Long Island native and board-certified family medicine physician, would step up as the organization's official health and wellness ambassador. In this newly created role, Dr. Reed would act as an advisor on health and safety-related protocols to tourism industry leaders, provide safe travel tips to visitors, and share her recommendations on how to enjoy Long Island's tourism attractions and vast outdoor experiences. A forward-thinking proposition indeed. It's no surprise that the innovator and trailblazer, CEO Kristen Jarnagin of Discover Long Island, was behind that initiative. In that same press release, Kristen wrote, "We are grateful to have Dr. Reed's medical expertise, lifestyle and wellness insight, and personal passion for Long Island to assist our organization in guiding our region through this challenging time. Long Island's tourism and economic recovery hinges on reopening our businesses safely and rebuilding consumer confidence to ensure that residents and visitors feel comfortable in venturing out. Dr. Reed's new role as our official health and wellness ambassador is an integral part of Long Island's ongoing recovery strategy that bridges the need to promote our tourism businesses and prioritize safety." I personally had the great pleasure of interviewing Kristen and Michele together for Destinations International's Advocacy Summit in 2020. And I'm really pleased to introduce them both today for a follow-up conversation about Long Island tourism, community, engagement, health and safety, and hope. So welcome to the Future of Tourism podcast, special episode, Back to the Beach, with Kristen Jarnagin and Dr. Michele Reed. Good morning, Kristen. Good morning, Michele. How are you? Where are you? What's it like?
Good morning. We're in Long Island, but here on Long Island we say we're on Long Island, right? That's one way you know you're a local, because you're on an island. So we're here. It's a beautiful spring day. The weather's gorgeous. We made it through winter, and we're starting to reopen, and we're starting to have weddings again and events, and we are incredibly busy.
Good morning, Michele.
Good morning, and thank you so much for the invitation, David. Wow, you ask, where are we? Yes, I am on Long Island. Very grateful to be alive, because a year ago on this very date, I had a severe headache. I was in bed, quarantined in my bedroom. But today I was able to get up at 6 o'clock in the morning and take one of my twin sons to the hospital for his first Pfizer vaccination. So I am grateful to be on Long Island today.
Well, that is fantastic news. And for those of you who don't know Dr. Reed, she is well known as the Fit Doc for her best-selling book, Mentally Fit, Physically Strong, The Fit Doc's Guide to Real Life, Real Fitness, and Real Health. But I got to drill into this for a minute. Having personally survived COVID-19, I know the story, but it's fascinating and terrifying all at the same time.
Okay. So a year ago, March, we were in something that we had no idea what was going on. And that is from at all levels of politics to the hospital to private practice. And we were all under assault. It really felt like we were at war internally. And with that being said, we didn't know how to protect ourselves, and whatever equipment we had as far as personal protective equipment, there wasn't enough to go around. We tried to make sure that we did the best so we didn't get sick, but unfortunately, many did get sick, many did die. And for me personally, we had to shut down my office because my entire staff got sick from COVID. And as a result of that, we had to build back up. And during that building back up process, that is how I met Kristen, because it was laid upon my heart to share my story. Because as a doctor, I went into the field of medicine to help people. And here we are in the middle of COVID-19, and I couldn't do anything. And that is exactly, I felt helpless. Like if I needed something to eat, my husband had to bring it to me. If I needed to go to the bathroom, I had to make sure no one else was around. I sprayed my Lysol as I was entering and exiting the bathroom in my bedroom. But I decided to videotape what I was going through. So it was a vlog, I guess. And God kept saying, share your story. He told me who to share it with. And that is how my regional newspaper covered my story over 4 articles, 4 videos. And from that, it just developed into a whole nother level because I think I was vulnerable. They talked about how it was for me as a doctor, as an owner of a private practice or a business owner, a mom and a wife to go through COVID, and how it not only affected me, but my business and my family, and then my relationship with my parents, because they're out there wandering around. My father, he's 80 something years old, like everything was okay. And I was like, no, your son-in-law can still help you. You still have your other children that can help you. There's no reason for you to show up at a store. So it was a lot of mixed emotions, but from where we are now, no one would have known like a year ago what we would have gone through. But like I said, I'm very grateful for where we are now, because me sharing my story led to me being on a platform with Kristen, and Kristen and I meeting and forming this relationship with Discover Long Island.
Well, and we're so glad to have you. And it was wonderful. It was midsummer last year, and you were recovering well from your bout with COVID, and your family was safe. Did you get your sense of smell back?
Well, I never lost the sense of smell or taste, but what I did lose, and I'm starting to develop, is my lung function.
Uh,
My breathing is still not 100%. I even just started acupuncture. And I think Monday night was the first night that was 2 nights ago that I was like, I can really take a deep breath and it doesn't feel tight. I mean, I went from running 3 marathons, New York City twice, Chicago once, to like barely being able to like run 2 miles. So it's a gradual process. So I think that's what makes me even more passionate, because it wasn't just done. The disease didn't just end and I automatically felt better. It's a gradual thing that I'm going through that I also can relate to with my patients, because one of the things some people notice, because the first sign that I had that my body was under attack was my heartbeat was fast.
wow.
And I still have patients who are 6, 7, 8 months out from having the disease who still have that racing heart. And all testing are showing everything is normal, but it's the way the virus attacked not just their circulatory system, but their nervous system too. And it's something that, I'm just excited about the relationship with Discover Long Island, because I want people to be healthy, but I also want them to explore where we live, because this is vital, not only to our well-being, but also to our economy for Long Island.
You said your son got his vaccination this morning. So on Long Island, asking both of you this question: where are we at in terms of vaccinations?
Well, where we are as of April 6th, if you are 16 years and older, you can now receive the vaccination, which is huge. I remember in March, I was at a TED Med conference and they were saying, oh, it'll be like 6 to 9 months before we get a vaccine. But when we were thinking about it, we weren't thinking about kids, we were thinking about adults. And here we have teenagers now able to get it. So I think that's huge. And a lot more sites are opening up. They even now have right here in Nassau County, you can go to the Coliseum, which is the home of the Long Island Nets, which I just did a program with today for Get Fit. So encouraging kids in elementary school to be fit. So numbers are definitely looking up. More and more people. I think they said right now, I think more than half of the people on Long Island have actually received vaccinations.
Fantastic. Kristen, your family vaccinated?
I get my second dose tomorrow, and then my fiance gets his second dose in a couple of weeks. And I'm a typical person. My daughter's also 16. Dr. Reed and I always share that our kids are the same age. And I've been trying to get her a vaccine since they were yesterday, and it's not 100% easy when the floodgates open. But you just have to be vigilant about it. But they are out there and they are growing, and the hope is growing. And Long Island is known for our iconic summers. especially to Long Islanders. I mean, no one loves a Long Island summer like a Long Islander. They're really why we live here all year long. And if you have not ever been to Long Island during the summer, it's just a special kind of flavor and feeling. It's really magical. And we missed it last summer, to be honest. It was scary. And even as we were reopening, we missed a lot of things. So there's a lot of, I feel like, anticipation and hope going into this summer.
So does it feel different this time, rolling into it? I mean, we're talking about a third wave. We're talking about more virulent strains that are highly transmissible. But do we look forward to a summer that might be a bit different than last year?
It feels to me a completely 100% different than it felt last summer. I mean, and I'll say again, Dr. Reed talked about what we went through in New York in March. I will say that I think what Long Island and New York went through is different than what a lot of the rest of the country went through. We were the second only to New York City as the epicenter for the number of positive cases, the number of deaths. So it was really, really, like Dr. Reed said, it felt like war. It was really scary. And so we shut down hard in New York and on Long Island. And when we reopened very slowly and strategically. And I think that you still see today, and I think this is why we're so excited and I just got lucky that we were able to see Dr. Reed and get together and that she wanted to establish this relationship with us because it's really paramount to what we're still doing today, which is reopening slowly and safely. It's so interesting because we were talking to other destinations that are like having full music festivals and full events and this and that. Just the other day, Great South Bay Music Festival, which is one of our iconic summer things, is not doing it this year. And things that are reopening here, we're still doing it slowly. We're still wearing masks. But I think, if you look at the latest data from Longwoods International, which says, still the majority of people want to travel to places that have really, strong COVID regulations in place and want to feel safe. We're practicing that here. So we feel very good about this summer because we are reopening in a way that we feel like is going to be awesome and fun. And you're going to have that Long Island summer, but in a place where you can feel safe and capacity is limited and people are wearing masks and people are still being vigilant.
Well, and that is honestly what fascinates me talking to both of you is I've watched you over the last year as Long Island. I've watched the two of you doing your work. I've seen a more integrated, more authentic, community-based approach to tourism redevelopment than I've seen in a lot of places. And Kristen, when we talked on the Future Tourism podcast last year, we opened with a quote, and if you remember it was Jack Johnson's from Destinations International, our chief advocacy officer there said, and this was prior to COVID, changes destination organizations, change significantly, change quickly, or face irrelevance. He was getting out in front of a movement that really was underlining the fact that the relevance of tourism organizations to their local destinations was becoming intangible or hard to understand. Before COVID, I know you're both working on that, but this strange synchronicity of events comes up. Michele, you actually get sick, and you're very public about what happened there, which I think was a wonderful thing in helping people address their fears. Kristen, you jump on that. You've been out in front of the idea of engaging residents ever since you landed in Long Island in 2015. You talked about a mindset that you have, that residents entrust you with their brand and representing their brand to their visitor. But to do that, you go out and you find partnerships that are completely unconventional. Our health and wellness ambassador to Long Island. That's a title that didn't exist prior to last year. What's it been like for you, Michele, in that role? I mean, you're out and about now. People see you in restaurants. You are the health and wellness ambassador.
That's funny. Why did you have to start about food? I love to eat, right?
I know you love food, but I also know that you are the fit doc. So temper that.
But it's funny because I have friends, I have family members, and they come to me and they'll say like, so which restaurant do you recommend that we go to? Because once we mention your name, it's like everything opens and everything is all good for us, even parking. So that's funny you talked about that. But for me, it's like, I have a family, and as a mom of boys, we like to do activities. We like to be outside the house. And the opportunity to be the health and wellness ambassador is something that I would have never thought about. But I'm enjoying the experience because as Fit Doc, what do? My gym is the outside. And my outside world is me exercising, me going to work, and then us having a good time. So when you're talking about we're going back to the beaches are opening, that's me. I love the water. And one of the things that I think I shared with you before was I never learned how to swim. And part of that was I was traumatized at the local park when my parents took me to learn how to swim when I was 4 or 5 years old. But what do you think happened this year? I learned how to swim in the open water. So I have me like 2 wetsuits, long sleeves, short sleeves, long pants. I mean, I am so psyched and pumped because I was able to explore the outdoors. So taking that another step, we're going to celebrate what I did. We're going to restaurants. We are going out to eat. And I've always been a germaphobe, but this is something that I like to see everyone washing the hands, things that they weren't doing before. You go to the bathroom at a restaurant, somebody walks in, they use the bathroom, they don't wash their hands. But now everyone is being conscious about what they're doing. And with the food industry, they were hit hard. And I think for me, so many of them are my patients, my friends, that I was passionate, that I was like, you know what? I need to make sure people know that it's safe to go out to eat and what your level of comfort is. And you know what? If you don't feel comfortable eating outside at the restaurant, go ahead and order takeout because you're still supporting them. So whenever they say, your total is such and such, I'm like, okay, don't forget to add a gratuity. Oh, you don't have to because you're not here. I'm like, no, I do. I said, because I'm a business owner. I want to keep you in business. And little things like that, that has been the difference. And me sharing my experiences of where I'm eating, where I know that they are very safe, good, proper protocol. And even Kristen and I, we visited some hotels because they were hit hard, especially on Long Island. And one of my favorite is like totally not in business at all now, but having people know what it's like from the moment you pull into the parking lot of a hotel, what it's like. You step in the door. Oops, I forgot my mask. Someone's right there. They're giving you a mask. The hand sanitizer is there. You don't even have to touch anything. You can check in online before you walk in the door. So things like that has helped to really increase everybody's level of comfort and being willing to travel to Long Island, because not just people on Long Island are following myself and Discover Long Island, people throughout the world. And when someone in Curacao says, oh, wow, I can go to Long Island and be safe. Yeah, they're going to travel. So things like that, I enjoy doing because that's my day-to-day life. What do I do?
Don't you see why I love her, David? Look at her. Isn't she, I mean, this is what she did when I met her. I'm like, who is this vivacious, passionate, articulate woman who is like going to be my new spokesperson?
You guys, the two of you make a dynamic duo, to say the very least. You embraced and highlighted something really remarkable in tourism that's really come into play, especially in COVID. And again, it was happening beforehand, but this idea that what residents want and what visitors want, surprisingly, are not at opposite ends of a spectrum. And we saw this, I think, Kristen, you and I talked about Copenhagen, where they did research and they found that, residents like quiet streets, safe places that weren't overcrowded, accessible food that they could get to and go from, clean public transit. Well, guess what? There isn't a visitor out there who doesn't like the same thing. But sometimes we get this mindset where we think, well, the visitor wants something different, but the visitor is you and I, and it's our families, and they want the same things. And I think I've told you this funny story before with Signe Junnerstedt from Copenhagen was on her way out on a Thursday night. And she said, oh, I'm going out tonight, David. We'll talk to you tomorrow. She says, I'm going to the bars. We'll see what it's like without the tourists. And her next day, her comment to me was, the Danes are a lot noisier than I thought they were. So, this idea that the visitor is well served when the resident is well served is something that's really coming into its own. And Michele, you've done such a great job being out there in restaurants, and I remember when you were talking to me about early days in restaurants, last June, July, and you're demonstrating this, sort of restaurant behavior thing, and it was tenuous. I mean, we were still sitting, 6 meters apart, and most restaurants, even now, are still at a fraction of the capacity they were, but there was a safe way to do it. Kristen, you jumped on that, and I really, if I could highlight one thing about your entire trajectory to get here, I appreciate the Cronkite School stuff you did in Arizona, the State Tourism Board, but I really love this focus on the idea that the things that locals value are the things that visitors value. You started a podcast last year and you're having a lot of fun with it and you're playing with it parametrically. Long Island Tea, is that the correct name?
That's correct. A
All right.
play on Long Island iced tea and spill the tea.
And spill the tea. There it is. You're having fun with it. You're experimenting, but it's really, again, it's a look behind the scenes in Long Island, what makes it tick, not just, the classic marketing of events and attractions, but a look behind the curtain. How's that going?
It is a lot of fun, and it's a new way. And again, I was inspired by you and Bill Geist, and I was doing these podcasts. And I'm like, wow, this is really amazing. And I try to learn from everybody, and we're still, like I said, tweaking it every day. But it's a lot of fun. Of course, we also highlight Long Island wines every episode, so we drink wine. And it's myself and our COO, and I'm a transplant. She's a native, so she has the Long Island history and roots. And she has little kids and I have older kids, and I'm on the North Shore and she's on the South Shore, which is a big deal on Long Island. And Dr. Reed's laughing. It's like a different world. It's 20 miles, but it's a different world. And so we take it from that perspective, and we really do. It's about what it's like to live and work and visit Long Island and pulling back the curtain. And so it's all the great things about Long Island, but it's some of the things that people don't know, like the fact that Long Island is made up of two really large counties. It has two incorporated cities and about 119 different towns, villages, and hamlets. It's crazy. In fact, I heard a stat the other day. There are 118 different fire districts on Long Island. That's more than New York City and Los Angeles combined. Mm-hmm. I'm like, it's a very like fractured kind of parochial. That's why the locals matter so much, because they're like little villages and they have loud voices. But it's funny and it's fun and the locals love it. But I think it's also interesting to people, whether you're from Long Island or not. We talk about the accent and the celebrities here. What are you going to say?
I think the village thing's really interesting too, because I must be getting old, but I've become fascinated with towns that are built on a human scale, where a town has a center and the center has a purpose. And it's really kind of fun to go to villages again, which I hadn't done in years. I mean, I was going to mega cities around the world, and villages have this huge appeal now.
There's pros and cons, and we talk about the cons too, right? And that's kind of what we talk about. We do talk about the cons of the villages. So the pros are that it is very small town. Dr. Reed, when she was on the podcast, we talked about how you go into your local restaurant, everybody knows you, they know what your favorite item is, the people around you. It is and yet we're in this metropolis area of 7 million people, but it does feel like that. One of the things I was going to talk about on the podcast is this little corner on my village. My village is called Setauket. I like to say it like a good Long Islander, Setauket. And it's near Stony Brook University, but we have this thing and I call it Political Corner. And it's hilarious. It's one corner, and every Saturday from a certain time to a certain time, they set it up, and each corner is a section. You've got the Trump people over here, and there's like a cutout, and they play Lee Greenwood constantly, and there's flags. And on the other side is all the peace and love. And over here, it's like the different, like just let it be. And over here, someone's like hot soup. You never know what they're gonna have a sign for, but each corner has their own. And weather not permitting, I mean, it's everything. They're always out there. And then at 2:00, they clean it all up. You would never know they were there. Everyone's gone. It's very peaceful, but it's like Shakespearean. I mean, it's hilarious. Anyway, there was a million stories, and we try to talk about what it's like and some of the cons are that it's very difficult to, sometimes it's in a time warp. You're in a time warp, and it's very difficult to get like housing done and to get development done, because a group of 6 people go to their village, council, and they protest, and then nothing gets done because everyone's like, oh, right. Those 6 people don't like it. So anyway, it's village life. It's never dull.
So let me ask you this. you've made a preponderous shift in your marketing. There's a lot more social, a lot more authentic street level stuff. You're still doing campaigns outside of Long Island, but you're also sharing this social outside of Long Island, and it's getting some pickup. It's being, people are sharing it, as you said, they can be in Cozumel and still realize, they're looking at Long Island from there. Michele, I'm going to ask you this before I ask Kristen this. You lived in Long Island. You were a resident. You knew it as a beautiful place. You've enjoyed living there, growing up there, raising a family, being active. Kristen, you're a transplant from south of the Mason-Dixie line. Michele, before Discover Long Island took this new tact, what's changed? What's different now when you think of Long Island? You think the way it represents itself to the world. Do you see a difference?
Well, there's definitely a difference because growing up, I mean, I was basically born here. And the original thing that when you thought of Long Island, you just thought of the I Love New York campaign. That was the only thing that you thought of. And then now with Discover Long Island, it's like, oh, wait a second. It's not I Love New York, but yeah, we can I Love New York, but I'm here in Long Island. So we're discovering Long Island. And so I noticed the difference. And also for me being part of the difference, I think that is helping to also increase the diversity because when people found out, like who were following me, that I was doing this, they're like, oh, wow. So that means we're going to be doing, I'm like, yeah, whatever. So this year we're supposed to be going to visit the aquarium because I knew the aquarium was there, but I didn't know there was a hotel there. And then I didn't know that I can also go and do some boating there. So, I mean, things like that make a big difference with increasing the level of exposure because now people say like, oh, wow, like these are like really truly hidden treasures. There are so many different things that are here that people have never done. So one of the things like Dinner on Blanc, for the last couple of years, they've been doing it on Long Island and going to different experiences. So people are like, wow, this garden has always been here. Like, yeah, it's been here for like years. But unless you get out and step outside of your usual bubble and also your commute, you would never know. And I think that's also one of the ways that I could say that was the beauty of the quarantine that we all had to go through. We were forced to figure out how to get along with our family, how to spend time with our families, how to be safe. And some people developed a core bubble of different families that they know that they only are associated with certain people. And that's how people started going out and exploring Long Island. For me, I think I needed to get out because, like I said, the gym is my outside. So I started developing challenges for each month. And people thought the challenges was like, I'm just trying to help them stay healthy. No, I am trying to recover and recuperate because it took me about 15, 20 minutes to walk about 4 houses because I was just so out of shape and out of breath and my heart was beating. So here we are now, a year after. I'm like, okay, we have another challenge going on for April. So we are walking and running at least 1 mile a day. We are doing planks because there's a different level of planks that you're supposed to do every day. We're drinking more water. And April is alcohol abstinence month. So what are we going to do? No alcohol until May 3rd, which is my birthday. So it doesn't get any better by that. And so what are people doing? So just now I looked at my phone. One of my friends who is in her 60s, her and somebody else who's in their 50s, they're like, we just want to let you know, because of your challenge for the past 3 days, we have been going to this park that's about 15 minutes away and we're walking. So I'm like, that's great. I was like, what time? I'll meet you. They're like, well, we don't walk as fast as you are. But I didn't respond back. But the sheer fact that, guess what? They're changing their mindset because a year ago, or maybe even 2 years ago, they weren't exercising like this. But me having the visibility, me talking about let's exploring Long Island, they're coming from Queens to explore Long Island with this park. So that's what's really helping our economy.
Well, that's super cool because my question was going to be next, does it look different to the rest of the world? Well, Queens is definitely the rest of the world from Long Island. So, Kristen, just expand on that a little bit. I mean, you really have embraced this idea of marketing an authentic Long Island. What does Long Island look like to the outside world? How do you frame that and parse that now? And what's different?
Well, I'll tell you, one of my stories is when I left Arizona, and I'd been there for over 20 years, and it was a shock wave. I was like, I'm gonna go be the CEO of tourism for Long Island. I'll never forget. Like I told my board of directors, and they were like, New York, Long Island, New York. I said, yeah, and they're like, I mean, no offense, but what's there? And I said, well, the Hamptons are there. And they were like, oh my God, really? That's where the Hamptons are? Uh, that's part of what you get to do. I'm like, yeah. And so people heard of the Hamptons, but they didn't know they were on Long Island. And then I came to Long Island, and Long Islanders, I said, I moved from Arizona. And they were like, oh, why would you move from Arizona to here? We're all moving from here to there. What are you doing? And I thought, this is crazy, because coming here, I thought it's so beautiful. And it is so quaint, and it's so, urban, and you have seasons, and you have the beach. And I didn't understand why nobody saw it the way I saw it, through the lens. And so, but you start talking to locals and you say, well, I came here because they have the most iconic beaches, and the schools here are great for my daughters. And everyone's like, oh yeah, the schools are epic and the beaches are amazing. And then they'll start talking the vineyards and I'm like, right. So you just have to get them talking. So that was kind of my motivation for, focusing on the residents and the locals, because if they're negative about the destination right away, then that communicates. And so just trying to teach the locals why I chose to move here, and why I love it here, and why it's a choice. I didn't have to, and why other people would do it too. And it's a community pride. So it's been really fun building that community pride and making them think, oh, we're not just I love New York. We can be proud to be Long Island. And there is a tremendous amount to do here. And that starts to emanate to the world. And what we did during quarantine is, establishing this position for safety and for protocol and all the things that we're doing to help communicate that during reopening, but making it long term. So Dr. Reed and I know that when this is over, and when, quarantine is a thing of the past, COVID is a thing of the past, to the extent that it will be, it's about wellness, and we're going to transition and that's why wellness is in the title, because she's going to talk about spas and getting out and being healthy, and wellness is always going to be a part of tourism. So we plan that for the long term. When we did the podcast and we did the YouTube station, Long Island TV on YouTube, we did that primarily to talk to locals and to keep the interest and the motivation going, but knowing that when this is over, we flip the switch, and that's a global audience on both platforms. So
you're already getting feedback from outside. People are talking to you. I know this because I hear them talking, but people are talking about what you're doing and your grassroots approach to marketing, aren't they? You've heard.
Yeah, it's been terrific. I mean, it's been really receptive, not only locally, but nationally and internationally. Now we have all of this great content that when people are ready to travel again, they can just tap into. And one of the things we just did on YouTube is we just created a new educational curriculum channel, where now we're putting out, because so many teachers and people are still doing virtual, and we're like, these are things you can learn about the region and history, and it's just just providing a resource to people, and whoever that person is, like you said, whether it's the resident, whether it's the visitor, whether it's the doctor or the teacher, is we want everyone to look to us to be a resource on the destination.
Cool. All right, we're getting close on time here. Let me ask a couple fun questions. Who are the most famous Long Islanders?
Me?
1, 2, 3. 1, 2, 3. Let's see if we do the same thing. 1, 2, 3. Billy Joel.
Billy Joel.
Me.
Michele Reed, absolutely. Michele C. Reed with one L.
Billy Joel is by far our most iconic Long Islander. And I think it's amazing because he's still, he's in the new Olivia Rodrigo song that all the kids, the number one song, Deja Vu. She talks about Billy Joel. But we talk about it on the podcast all the time because there are Billy Joel sightings everywhere for Long Islanders. Anyway, Billy Joel is like the god. But Dr. Reed, right? There are a million Long Island celebrities. There's Howard Stern, there's Billy Crystal, there's Debbie Gibson, Mariah Carey, Natalie
Murphy, Ashanti.
Yep.
Eddie Murphy's from Long Island?
Yeah, Roosevelt.
No way.
Dr. J.
Dr. J.
His home is here. It's a national park. It's called Sagamore Hill, Teddy Roosevelt.
Cool.
Okay. So many.
Most famous business in Long Island.
Probably Estee Lauder. What would you say?
Yeah.
Canon.
Well, at one point in time, it used to be Grumman.
Okay, that would be I was going to ask you, can I go to Grumman and see the Lunar Module Museum? Do they have one?
It's called the Cradle of Aviation Museum. I was just there. In fact, there, if you watch our Long Island TV called Museum Row, you'll
Okay.
see it. They have the only I can't remember what it's the lunar module. They have one there, the only one
Yeah.
on Earth that you can see,
Yeah.
that you can walk through because it was supposed to go to space. It's amazing.
Well, okay. So now I'm coming to Long Island. I'm asking Michelle where to eat, and then I'm dropping her name like it was $10 bills to make sure I get good parking. And then we're going to the park.
Yes, and the Cradle of Aviation, and then the
All right.
vineyard.
All right.
Oh
So in
yes,
terms of
vineyard. Yes,
vineyards, yes, but but not until May 3rd.
Oh,
Until your birthday.
well, that's funny you said that because my husband's birthday was March 23rd, and I felt bad because he turned 50
Uh-oh.
and we weren't able to really celebrate his birthday. So I was like, okay, we're going to do a do-over. So I asked Christian, I said, where can we stay on Long Island? Because, quote unquote, we're going to be leaving the boys alone because they're just about 17. And she's like, Arborview. So it's a cute bed and breakfast. And we went there. He had no idea where we were going. He's like, this was so much fun. And so he's like, so what are we doing? I was like, whatever you want to do. So of course we went to a vineyard. It was pretty by the water. The deer were walking out there. It was very quiet, just myself and him and another couple. But it was an experience that we were able to have together on Long Island because we're discovering Long Island. And we never really talk about the North Fork. We always talk about the South Fork. And we were like, the guy who owned the place, he's like, just drive out like a few more minutes and you're going to be at the end. I'm like, what? And we went to Orient Point, took some pictures, went to the park. So it's about us having our own separate experience because neither one of us had been there and we hadn't been there together. And we celebrated his birthday and some nice wine and good food too.
We'll show you around, David. We'll show you around. Don't worry.
All right, so summer 2021, back to the beach in Long Island, right? Socially distanced and socially responsible, but we do get outside and we do get to take in some of that splendor, right?
One more thing, David, that you have to do if you're an aviation nut is, and it was canceled last year, but it was just announced it's back on this year, is the Bethpage Air Show at Jones Beach. Every other year it's the Thunderbirds or the Blue Angels. This year it's the Thunderbirds. It's so scary for me to go to air shows, but this one's right over the ocean. You sit on the beach and you hear the music, and it is so amazing. Highly recommend. And
That's
it's
part of my childhood. We used to go there every year.
It's a big deal. It's the official kickoff to summer for all of Long Island. Is that show on Memorial Weekend? It starts our season, and everyone knows it's officially summer, and just awesome vibe.
So you guys, when I'm hearing that your teens are getting vaccinated, you guys got to be approaching 50% vaccination then on the island, somewhere in that range.
Yes.
All right, that bodes well for summer. Then that does help, doesn't it?
But that doesn't mean we have to like take off a mask. No, you still need to wear your mask, especially when you are around people that are not within your quote unquote family. You still have to be very careful.
And you'll see that from New York, and you'll feel that when you visit New York. You'll feel the continued vigilance, the continued precautions, but the ability and the confidence to go out and do it safely, and the limited capacity. But that's what makes everyone be able to enjoy yourself.
Well, you guys have done an absolutely remarkable job of modeling that to the rest of the country, and I want to thank you for that. And you've done it in a encouraging and lighthearted, and it was just, as we said at the beginning, hopeful way. And I thank you both for that. It's a real pleasure every time I talk to you. I'm looking forward to when we can get back together again. I'm totally looking forward to your birthday. Happy birthday, Michelle.
Thank
Kristen, you're welcome. It's always good to talk to you.
Thank you. We'll be looking forward to seeing you soon this summer. So just get us an email and we'll plan it.
Oh, we can drive from here. It's not bad. It's a 10-hour drive. There we go.
That's right.
All right. Have a great day.
Thank you.